5 years ago, I used to get asked all the time, what is the future of Eastern Kentucky? We were in the midst of this downturn in the coal economy that Rocky talked about there. I used to get asked, what is the future of Eastern Kentucky? And my response would always be, the best way to predict the future is to create it. And what we started 5 years ago with SOAR, when I say we, lots of different people stepped up. Congressman Rogers leading the charge to get this movement off the ground. SOAR is not another economic development agency. It's not another government agency. We're a nonprofit. It's a movement of the people of the region to take ownership of the future of the region. And so we started down that path. How do we create the future? How do we build consensus around a plan and around a work and get things done? Earlier this year, I became convinced, I believed it the whole time, but I became convinced earlier this year that there is a future in Eastern Kentucky. So we launched a campaign earlier this year and launched a website, thereisafuture.org. You may have seen our billboards or some of our commercials. But if you want to know more about SOAR's work, here's one thing I know. The future of Appalachia and Eastern Kentucky hinges on two main things. One, our ability to leverage technology, connectivity and technology. How do we leverage it for the future of the region, for economic growth, for healthy, better health outcomes? How do we leverage technology? But two, most importantly, is our ability to do it together. Like, we either do it together or we don't. And when I say together, I mean we got to have higher ed institutions working with economic development and private sector and health. We can have the healthiest workforce in the world, but if we're not creating jobs, there's nowhere for them to work. We can create all the jobs in the world, but if we don't have a healthy workforce, there's a disconnect. What SOAR says is collectively, we all have to take ownership of our own portion and see that we're all working in this together. So you can go to this website. You can see three main things there. One, you can see our plan. We actually have a blueprint for a 21st century Appalachia. It's got 7 goals. They're simplified there. We've got a deeper dive on it, about 20 pages. If you just love to read great, blueprints and economic plans, we got a deeper dive that you can get to. The second part of it is the partners. We have 200 organizations, individuals who have united together and bought into consensus around this plan. From the governor's administration, you've got so many of Governor Bevin's representatives and people from his administration here today that are working this same plan, from Congressman Rogers at a federal level working this plan, to people on the ground in offices, small businesses, mayors, working the same plan. I've read every plan since 1960 for Eastern Kentucky. There's never been a movement and a connected effort like we have right now. What I say all the time is I believe we're on the right side of the momentum. Not every problem is solved. It's not, we're not hanging up our hat and saying we did it by any stretch. But we're on the right side of the momentum. That's why it's important, I think, that the name of this event today is Turn the Tide. I think the tide is turning. I think the stigma, the widespread perception of substance use disorder and drug addiction is changing. I think this vision from crisis to career is catching on, and it's happening. So I'm thankful for you being here, and all you medical students that didn't have an option, welcome. Hope you're excited to be here, because you should be. Because in the work that you're going to do, you are going to deal with this more than any one of us. And collectively, the hundreds of you that are here, if you decide to have an impact and play a role in this, can make a bigger difference than any policymaker or nonprofit outside of your work that could ever make. You can be the difference in one life, and 100 lives, and 1,000 lives. And we need you as part of this movement collectively as we try to build a 21st century Appalachia. That's my word. You won't hear from me for a while, This morning we've got great speakers who know this topic inside and out. We've got a special pre-recorded video we want to share from the directors of the Centers for Disease Control, Dr. Robert Redfield. So if you would, turn your attention to the screens, and we've got a great video message from Dr. Redfield.
Hello, I'm Dr. Robert Redfield, Director of the Centers for Disease Control and Prevention and Administrator of the Agency of Toxic Substances and Disease Registry. The ongoing opioid epidemic is the public health crisis of our time. There isn't anything more important to the health of our nation than the work you will be doing at this conference. Together, we're going to end this crisis. And as we do, there's one essential element we must all remember. Stigma is the enemy of public health. Opioid misuse is not a moral failure. It's a treatable medical condition. With me today is Dr. Deborah Howery, Director of the CDC's National Center for Injury Prevention and Control, and an emergency physician. Dr. Howery, confronting the opioid epidemic is a key priority for this administration. Can you highlight the role CDC plays in this response?
So I think just like you, I left clinical practice to come to CDC because I knew the impact CDC has when it comes to things like confronting the opioid epidemic. We have quick and timely data so that states can use it to address responses as they happen. So data is one of our key efforts. We actually have something called syndromic data used for things like foodborne illnesses. And again, we're able to then have, within 24 to 48 hours, data states can see upticks in overdoses, respond immediately. I'd say the other thing CDC is really key at is working with state and local health departments to prevent people from getting addicted in the first place through safe prescribing, working with prescription drug monitoring programs, and other health systems interventions.
Can you comment about the guideline that we're developing also for both physicians and the public?
Absolutely. So about 2 years ago, we developed an opioid prescribing guideline for chronic pain, and that was really focused on 12 recommendations for primary care providers. And it's about looking at the patient in front of you and balancing the risks and benefits of an opioid for each patient. And what we recommended was that for patients with chronic pain, opioids are not the first line. Non-pharmacologic or non-opioid treatment is preferred.
Can you tell us about the CDC's efforts, how they're beginning to make an impact in improving the quality of opioid prescribing and pain care?
So since we have seen the opioid guideline released, we've seen a decrease in prescribing of high-dose opioids and overlapping dangerous combinations like opioids and benzodiazepines.
Can you also discuss the importance of healthcare providers and how we can continue to support them to do their clinical work?
So I think healthcare providers are really on the front lines of addressing this epidemic. I think when a patient's in front of you, making sure, does that patient need this opioid drug, or is there a different medication, and making sure that we provide appropriate training. When I think both you and I were in medical school, we probably didn't have the level of training that now we're starting to see in medical schools. And CDC has partnered with 200 plus medical schools, nursing schools, and pharmacy schools to get safe and effective prescribing education into the curricula.
Could you talk a little bit about the tools that CDC has provided and developed for providers?
So I think, when we developed our guideline, we knew that it's a long document. You need something that's really, hands-on and easy to navigate. So we developed a mobile app that has functions on it like high morphine milliequivalent calculators, also things on motivational interviewing. So if you have that patient in front of you, how do you have that conversation with them? We've also developed things like a checklist. So what are the key things to think about? And then finally, we have online medical education, free, with continuing education credits.
Can you also share some examples of local, regional, or state efforts that have been implemented to confront this epidemic?
So I think all of our local communities and state efforts are key in addressing this, and each state and community is unique. A couple, I think, really great successes recently are when you look at West Virginia, they've been able to look at their prescription drug monitoring program and send out notifications to those that have high prescribing patterns to reduce that. You look at states like Ohio, and they're using that data system I talked about to look at upticks and to really work through local health departments. And then Kentucky has used some of our CDC resources to develop linkage to care, or a website that really helps people navigate where to find treatment.
I want to thank you for sharing your expertise with us. The immediate problem facing the nation is ending this epidemic of overdose deaths. Naloxone's availability is part of the solution. Harm reduction through syringe service programs is also part of the solution. And most importantly, effective treatment is essential. It's important that we never underestimate the possible. Working together, we will end this crisis. And I want to thank all of you for being part of that solution.